There we go again. So I'm very pleased to say that I'm now joined by Pooja from Heart's Visiting Angels. I've never heard of this organisation, so please tell us who you are, where you come from and what you do.
Hello, thank you Mike. So I'm Pooja from Visiting Angels. We're a local home care company in the area. We're very different to other care companies because what we do is we put our carers at the heart of everything that we do. So we're trying to change the world of care where people can be more looked after by people who actually want to come and genuinely do the job. We have a huge passion to keep people at home. We really advocate for them to stay at home within their familiar environment, surrounded by their memories. So we can actually do everything, right to the end of their life. So we are regulated by the CQC. So we can do everything from just companionship, but taking them out shopping and helping them around the house, but also kind of more complex care. So we can do stoma care, catheter care, peg feeding, all the way to palliative care, which is right to the end, really.
Oh, that's absolutely amazing. So, how do people access your services?
So they just give us a call and then we come out to do an assessment. So we get to know you, you get to know us, because this is a trade where it's a service where you have to really trust the people that come into your home. So we come in, we spend an hour or two with you, we get all the information, everything from how they were brought up, where they were born, who's in the family, and then we go back, write the care plan. As easy as that. We can start very, very soon.
That sounds like you're saving the NHS quite a bit of money by keeping people in their home and their comfortable, familiar surroundings. How does your organisation get funded?
So we are private, but unfortunately within care the threshold for savings is really, really low. So I think it's just 23,500. So unfortunately we have that in savings. There's no help from the government, which is something we're working towards as well. We got a mention in the Houses of Parliament not too long ago. It is really tough, and it's something we are talking to the local MPs about and the government, because there does need to be a bit more support, because the companies that do go for the local authority contracts and things, the government just doesn't have enough funding to give to people like us. So what happens is that only has a knock-on effect to the carers. So they get, paid very, very badly, minimum wage, 15-minute visits, running around from side to side, don't get the travel time money. So they're out working, 6 hours, 8 hours a day, get paid for 6. So they just lose the passion and they don't want to be in care anymore. So, one of two things happen. Either they leave the industry, go and work in like a supermarket because they get more money, or they come to work very grudgingly and the quality of care out there it goes down completely. So this is where we're different. We do 1 hour visits, we pay our carers very, very well. Our recruitment process is so thorough that only the people who genuinely want to come and care for others get through the door. Because we're just trying to, I think, improve the quality out there. We want to be the very, very best. Because elderly people, they do deserve the very, very best. The elderly nowadays, they lived through wars, they've never taken anything, they've always worked really, really hard, and now that they're getting older, I think it's a huge thing to be able to look after them in the best possible way. And like you said earlier, we're the first point of contact a lot of the time. So we go in, we see an example, Margaret, we see Margaret every single day. We can see that, she's deteriorating a little bit. We're the ones who then step in. We phone the doctors. Quite recently, we've stopped 2 ladies going into hospital because we picked up their symptoms first, contacted the doctors, literally brought in the hospital home team to treat her at home. So that saved a bed in the hospital, saved the NHS a lot of money. But on the flip side, we managed to keep her at home where she was more comfortable. And she just got better quicker, I would say, than if she did have to go into a hospital, where it's quite traumatic for a lot of people, actually.
Yes, my own mother is 91 and lives in sheltered accommodation. She has carers going to see her 4 times a day, usually for only 10 minutes, as you said earlier on, sometimes 15 minutes, and it's never the same person twice. So with your organisation, does that mean that the caree gets the same carer on a regular basis?
Yeah, so we put in a team. Visiting Angels as a whole, we actually have the lowest staff turnover rate in the whole industry. So we're at 92%, which is unheard of because we really look after our staff, you know, and that is the key. If you do want the same people coming in to see this particular clients, you really have to look after your staff really, really well. So we treat them like family, and our ethos is being care-centric. So we do events for them, you know, really treat them like our family members to empower them to be able to go out and give the best possible care. So all our clients, they have a team of, depending on how many visits, maybe 1, 2, 3 carers, and they don't see anybody else. So you'll never see anybody new with us. And there's always Shelley and myself, you know, we're very hands-on too. So we go out to see many, many clients ourselves because we want to make sure that we are kind of giving the very best.
That must be good for the person receiving the care. They get the continuity of seeing the same person. I guess the carer then in some ways becomes a friend or almost part of the family.
Yeah, professional family member we like to call it. It's so important, especially when people have dementia. You know, you can't be sending in strangers for 5-10 minutes because that's quite worrying. You know, imagine if somebody comes into your home, your safe space, you don't know who they are, and they start, you know, trying to give you a wash or trying to touch you, and you think, oh my gosh, you're like, I think that now, but imagine if somebody has dementia. And you have to ask yourself, you know, in the morning, how long does it take you to get ready? By the time you've woken up, got out of bed, gone in the shower, done your hair, brushed your teeth, you know, got changed, had your breakfast. Can you do that in 10 minutes, 15 minutes?
Well, it doesn't take me long to do my hair for obvious reasons, but no, I can't get all that done in 10 minutes.
No, and this is the thing, you know, where the days are getting shorter now, it's called sundowning. So 8 or 7 o'clock in the morning, it's pitch black. So what if you go into a client, they're not ready to get up at 7 a.m, but the carer's only got 15 minutes, so they have to get the client up, you know, very rushed service. That's not what care should be like. You know, it should be on their terms. Okay, they're not quite ready to get up, then they'll go and do things around the house and tidy up and then get the client up in a really kind of nice way. Give them the time and the attention that they deserve.
That sounds amazing. So Visiting Angels, is it just Hitchin based?
No, we are national and international actually. We have over 70 branches across the country, but each branch is run individually. So I run this branch with my manager, Shelley, and my husband. The reason I opened up Visiting Angels in this area, it's a really personal journey for me. I lost my father when I was really young, then my mum was really poorly growing up, and we always lived with our grandmother. My grandma, she was my best friend, you know, I've always lived with her. She was the first one to hold me after I was born, and right to the end, I'd always been with her, and she always used to say, please don't put me in a care home, please don't put me in a care home. I always promised her, you know, I'll never put you in a care home, I will look after you, and we did right to the end. And that's just, like, it was such a privilege, it really, really was. But, you know, not everybody lives close to family. That's always a big one. People don't want to be a burden on their families nowadays. So this is why we've opened this service up in this area, because it's not only to help the clients, but it's also to help family members, because I know firsthand how hard it is to look after a loved one. You do lose a lot of your personal life, you lose a lot of your social life. So what I want to do now is take that burden off family members, you know, leave mum and dad with us, come in and just be a daughter again, be a son again. You don't have to be the cleaner, the cook, the shopper. Just come and have a cup of tea. But that's your job. And let us do everything else. We'll do all the hard work around. And so many people, you know, they say it's literally like we're their family members. I think it's that narrative with care, you know, it's quite a scary thing to let somebody into your home. But once you get over that and you realise it's not, well, with us, it's not that bad. We don't wear uniforms, you know, so we do quite blend in quite easily into people's lives, and we do things on their time and their pace. So,
Pooja, that's absolutely amazing. Thank you so much for sharing what Visiting Angels do with us and with everybody else in Hitchin here. So if anybody would like to find out more information about Visiting Angels, they can find you at your stall just opposite Barclays Bank, can't they?
and Greg's, delicious.
And Greg's, yes. Thank you very much.
Thank you.